It just kept getting worse. Putting my jacket on, the stiffness in the right hand started going to my whole arm. It just got to be more pain. I remember trying to wave to my kids and I had lifted my hand up and I couldn't move it. I couldn't do this motion. As it kept getting worse, that's when I was introduced to Dr. Barbu.
Bend the wrist down.
I was diagnosed with early-onset Parkinson's.
The wrist up.
My name is Dr. Shadi Barbu. I'm a movement disorders neurologist here at the Cole Center. And when I see our patients with Parkinson's, Huntington's, essential tremor, they come with us with symptoms that are very debilitating, and so we evaluate, diagnose them, and then we come up with treatment plans.
Just getting dressed, brushing my teeth, those kind of simple things were very difficult.
This is a young, active family man that wants to do things and to be there to take care of his family and to work, to enjoy life. Some of the symptoms he was having was limiting that, so we wanted to try and improve those symptoms.
When I was sitting down at the piano, my hand was just going a lot slower than my left. Now I got this tremor in my left hand, and so this hand is hitting extra notes, and this hand can't move. I was trying to just play catch with my daughter with a football, and I couldn't throw the ball toward her. I always missed. And one day she said, "Dad, maybe you do need to have that surgery."
Good to see you. How you feeling? My name's Carter Gerard. I'm the Director of Functional Neurosurgery at UT Medical Center here in Knoxville. The ability to reverse those, reduce those, and get them back to their normal life is what we want to do. We're going to be putting the electrodes here. The subthalamic nucleus is right about here.
Deep brain stimulation is a brain surgery. We make 2 openings on the top of the head here, and we put very skinny, flexible wires in the areas that are involved in like Parkinson's disease, essential tremor, dystonia. Everything's under the skin, and it comes down behind your ear to a battery pouch under your skin, pretty much like a pacemaker. So right now I'm going to slowly go up on the settings until I see a difference. I can connect to this device wirelessly and send electrical signals up to the brain to control symptoms. Let's see what your exam looks like now with the changes. Hold both your hands out. I like what I see. Now with the left hand. So go ahead and walk down, turn around. Deep brain stimulation, it's very life-changing for a lot of people.
Having the DBS surgery has helped tremendously already for daily life, but also is giving a lot of hope for years to come.
These are the stories of the region's academic health system.